Abstinence of appendix food after surgery. Patients with appendicitis who have just been operated on need to pay attention to the food they eat, so that the disease does not recur. This dietary taboo for appendicitis that must be known. Appendicitis can be considered troublesome. The reason is, the disease makes the patient obliged to regulate the type of intake consumed so that the condition does not relapse or get worse. Surgery is a way to treat appendicitis. After surgery, it is very important to follow the doctor's instructions regarding dietary restrictions for appendicitis. Because, if you eat wrong, the recovery process can be hampered and cause complications. Then, what are the dietary restrictions after appendicitis surgery? Abstinence of appendix food after surgery. The following are appendicitis food taboos that must be obeyed by patients who have just finished surgery. 1. Food or drink with lots of gas. After surgery, the patient generally feels bloated. In order not to aggravate the complaint, avoid foods that contain gas. Intakes that contain a lot of gas, such as lettuce, broccoli, and beans, can cause flatulence and bloating. This condition can interfere with the part of the intestine that is healing, so the risk of recurrent appendicitis may increase. 2. Foods and drinks high in sugar. This is one of the appendix food taboos that need to be considered. This is because sweet intakes that are high in sugar can make stools out of the digestive tract faster. This condition is not good for the intestine, which is still in the healing process. If your tongue still wants a sweet taste, try to eat fruits that are low in fiber. For example, bananas, melons, cantaloupe, or watermelon. Besides not having a lot of fiber, these fruits are also rich in water and refreshing. 3. Fruits and vegetables are high in fiber. Under normal circumstances, high-fiber fruits and vegetables are really needed and beneficial for the digestive tract. However, this type of intake becomes a food taboo during recovery after appendicitis surgery. The reason is that your intestines are not able to digest fiber foods optimally. This will make the intestines narrower, and eventually stomach pain or inflammation can reappear. 4. Spicy food. As an Indonesian, being told to stop or not eat spicy food at all is quite excruciating. The reason is, without chili, the taste of food becomes bland and unappetizing. However, spicy foods should be avoided for a while to give the intestines a chance to recover. Foods that contain chili and pepper will make stomach acid rise, so that the upper stomach is uncomfortable. One of the most prominent discomforts is nausea. If you are very nauseous, you can't even hold back vomiting. In fact, the contractions caused when vomiting can trigger other complications after appendicitis surgery. 5. High-fat foods. High-fat intake is also a dietary taboo for appendicitis. During the recovery period or about the first 7 to 10 days, patients are not advised to eat foods that are high in fat. This is because these foods will cause the remaining fat in the intestine that has just been operated on. In addition, eating foods that are high in fat has a high risk of triggering diarrhea. This is not very good for your intestines, which are recovering. 6. Solid textured food. After a person completes appendicitis surgery and is recovering, it is best to start with light and easy to digest foods. This is because these foods do not put pressure on the digestive system and reduce the chances of nausea and vomiting. Therefore, solid textured foods include foods that should not be consumed by appendicitis sufferers. Solid food will take longer to digest by the intestines, while the intestines still need time to recover. 7. Alcoholic drinks. Please note that alcohol can interfere with gastrointestinal function, so the healing process of a recently surgery intestine can be problematic. In addition, alcoholic beverages should not be consumed while a person is taking antibiotics, because the use of both simultaneously can increase the side effects of the drug, such as severe headache, nausea, vomiting, and diarrhea.